Assalamu alaikum and welcome to the Dr UUT channel. In this video, we will talk about the mechanism of action of angiotensin converting enzyme inhibitors. Well, this lecture is available in Urdu, so now we'll commence the lecture in English. In order to know the mechanism of action of the angiotensin converting enzyme inhibitors or ACE inhibitors, you must know or you must have the information regarding the RAS system, which we have already explained in our previous videos. Well, we'll give a little bit review in order to understand the topic in a very easy way. When there is a very weak or less blood perfusion to the kidneys, there are some cells known as macula densa cells. Those will sense the perfusion of the blood and some salts, and then they will give the signal to the JG cells, juxtaglomerular cells, and they will release the renin. This renin will reach the liver where the angiotensinogen is present. This renin will convert that angiotensinogen to angiotensin 1, and this angiotensin 1 will then forward it towards the lungs where the enzyme is present known as angiotensin converting enzyme, which is responsible to convert the angiotensin 1 to angiotensin 2. The name is also telling us something, that angiotensin converting enzyme means that it is converting something, that is actually angiotensin 1 to angiotensin 2. And further, the job of angiotensin 2 is to release the antidiuretic hormone from the pituitary glands and the release of the aldosterone from the adrenal glands, and it will also cause the vasoconstriction, due to which what will happen, the blood pressure will increase, or you can say physiologically afterload will increase on the heart. A kind of stress will generate. So we often use these medications in case of hypertensive patients or in case of heart diseases, etc. Well, coming to the point, what is the mechanism of action of the ACE inhibitors? You know, ACE, this is ACE, angiotensin converting enzyme. By these drugs like captopril, enalapril, all pril drugs, by mean of those drugs, we are actually inhibiting this enzyme. If we inhibit this enzyme, we are actually blocking the conversion of angiotensin 1 to angiotensin 2. If there is no angiotensin 2, what will happen? There will be no release of antidiuretic hormone, no aldosterone, no vasoconstriction. You can say the blood pressure will decrease and the afterload on the heart will decrease. Like this, somehow the hypertension is managed by this drug. Well, this enzyme has got two functions. The very first function is that it is converting 1 to 2, means angiotensin 1 is converted to angiotensin 2. This enzyme is also responsible for the breakdown of the bradykinin, means it will inactive the bradykinin. When we block this enzyme, what will happen? It will not convert the angiotensin 1 to angiotensin 2, and the bradykinin will no more be broken. So the bradykinin will become active. Why? Because ACE is not present. When the ACE is not available, so then the bradykinin will start showing its activity. So now what are the activities of the bradykinin? Bradykinins actually, they are the vasodilators. They will dilate the vessels. So due to which oftentimes we see some side effects with the captopril, enalapril, these drugs, means the ACE inhibitors. Like those two side effects are edema and dry cough. Edema, you know, it is a vasodilator. It will dilate the vessels, due to which what will happen, the tissue fluid will accumulate in the tissues. So like this fluid accumulation in the tissues or in the peripheral or in the lungs, which will cause the pulmonary edema and peripheral edema. So this edema is caused because of what? Because of this bradykinin, which is actually dilating the vessels. Angiotensin 2 was constricting and bradykinin was dilating. Before, ACE was breaking this bradykinin. Now we blocked this, so angiotensin 2 is not produced and bradykinin is produced now, means its activity is increased. It will cause the vasodilation, so like this blood will ooze out from the blood vessels and edema will occur, like pulmonary edema and peripheral edema. And dry cough is also seen with these drugs as a side effect, means captopril and enalapril. Why this dry cough is seen? This bradykinin is again responsible for this dry cough. This bradykinin will reach the lungs and it will stimulate the irritant receptors in the lungs, and due to which what will happen? Dry cough will be seen. So like these two side effects like edema and dry coughs are seen with the side effects of the ACE inhibitors when we block the ACE inhibitors. By blocking the ACE inhibitors, we are actually increasing the activity of the bradykinin and decreasing the conversion of angiotensin 1 to angiotensin 2. So like this, it is causing these two side effects. Why? Because angiotensin 2 is no more produced and bradykinin is actually produced. Normally, these cases are seen in very rarely or in rare patients. Often the patients are treated with S. When these side effects are seen, then the patients are given the next therapy that is called as ARBs.